Hi guys, welcome back to my channel. So today we'll be starting with the third part of the 20th notebook topics, and here we'll be completing microbiology, which is in itself an entire volatile subject or topic. Okay, so we'll just go through the basics very quickly. So the bacterial structures are flagellum and pili, which are the appendages, and the flagella is composed of proteins, while pilus is composed of glycoproteins. Right? Flagellum is involved in motility, while the pilus mediate adherence to the cell surface. Right? For example, the sex pilus it is formed during the conjugation. Okay. Next, specialized structures like spore. Remember that it is made up of dipicolinic acid and it is only seen in gram-positive bacteria. Then some envelopes. First is the capsule, right? And it protects against phagocytosis. Second is the slime layer. Now it plays a major role in the biofilm formation, like the pseudomonas infecting the indwelling catheters. Then outer membrane, it is the outer leaflet that is containing the endotoxin. Remember that endotoxin is only seen in gram-negative bacteria and it can be lipopolysaccharide or lipo-oligosaccharide. Right? Others can be lipid A, which induces TNF alpha, IL-1, and antigenic O polysaccharide. Okay. So here we can see a gram-negative cell wall, and you can see the outer membrane that contains the endotoxin, and it also contains sporin. Right? Next is the periplasmic space. This is the space between the cytoplasmic membrane and the outer membrane in the gram-negative bacteria, like this one. And this periplasmic space, it contains beta-lactamases. Okay. Then cell wall, it is made up of peptidoglycan. And finally, cell membrane. The cell membrane, it contains penicillin binding proteins, and unique structure to a gram-positive bacteria is lipoticoic acid, which extends from the cell membrane to the out. So here we can see gram-negative cell wall with the lipoticoic acid. Okay, so how will you identify? First, the gram-negative will have a thicker peptidoglycan layer, while it will be thin in gram-negative bacteria. Then in gram-positive, the additional structure is lipoticoic acid, while in gram-negative, the unique structures are the outer membrane containing the endotoxins. Right? This question was asked in NEET November. And the other unique structure is the wide periplasmic space. All right. Then let us quickly look at the stains. Gram stain, right? It stains thick peptidoglycan layer violet, as in gram-positive bacteria. So gram-positive will be violet in color, while gram-negative, which has a thin peptidoglycan layer, will be stained with the counter stain, and therefore the gram-negative will appear pink. This question was also asked in November NICT. What are the components of gram stain? So it is a violet dye and a pink dye. Some bacteria, they do not stain well. Okay, you need to remember these. The mnemonic is also nice, like these little microbes may unfortunately lack real color but are everywhere, or they can be remembered by themselves. I've remembered them by their names only. Okay, so they are Treponema leptospira because they are very thin to be visualized. Second is mycobacteria. It has a very high lipid content. Okay, so therefore it is not gram stained well. Third is mycoplasma and ureoplasma. They lack cell wall, so they cannot be stained. And finally, Legionella, Rickettsia, Chlamydia, Bartonella, Anaplasma, and Ehrlichia, because these are primarily intracellular organisms. Okay, there is an important point that in Chlamydia, there is not the classical peptidoglycan layer because of less muramic acid. Giemsa stain. So Chlamydia, Rickettsia, and trypanosomes are stained by it. Others are Borrelia and Helicobacter pylori. There is also a mnemonic. If you want to remember, clumsy Rick tripped on a borrowed helicopter plastered in gems. ठीक है, Rick and Morty का Rick, तो he tripped on the helicopter which he borrowed, and the helicopter was made of gems. ठीक है, तो just remember visually. This is the helicopter. I'm so bad at drawing. ठीक है, this is Rick and Morty वाला Rick, and this helicopter is covered with gems. ठीक है, so this the Rick, he's clumsy. So clumsy Rick tripped on a borrowed helicopter. He borrowed from the phoenix person, whatever. Okay. And the phoenix person had plastered gems over it. तो फिर क्या हो गया निमोनिक? Chlamydia, rickettsia, trypanosomes, P से borrowed borrelia, helicopter, helicobacter pylori, and P से plasmodium. ठीक है, and gems is giemsa stain. Next is periodic acid Schiff stain, right? Remember, we studied in pathology that it stains glycogen, mucopolysaccharides, and also Whipple's disease as well as A beta lipoproteinemia. Okay, here we can see Whipple's disease, which is stained by PAS stain. Remember, it is PAS positive diastase resistant. Okay, the only PAS positive diastase sensitive is glycogen storage diseases, and this is Giemsa stain that is showing the trypanosome. So these are all Ramnowski stain. Next is Zedin stain, right? And it stains acid fast bacteria like mycobacterium, right? And nocardia, because it has mycolic acid in its cell wall. Also, it is used for staining protozoa. So here we can see Zedin stain staining the mycobacterium. Then next is India ink stain. It is used for Cryptococcus neoformans, right? Remember, musicarmine can also be used, and it appears thick, which we saw in our pathology slide. This is India ink stain staining the Cryptococcus. Then silver stains are usually used for fungus. Remember, silver stains will have black appearance, and it can be used to demonstrate coccidioids. Pneumocystis jirovecii, which has a saucer and cup appearance, which we saw in again the patho slides. Then other organisms are Legionella and Helicobacter pylori. Helicobacter के लिए we use Worthen silver starry stain. ठीक है, and this stain is also used for Campylobacter. Remember, Campylobacter and Helicobacter both have bacter in their names and they go simultaneously. They have most of the features same. Fluorescent antibody stain. It is used to identify bacteria, viruses, Pneumocystis jirovecii, then Giardia and Cryptosporidium. Example is FTABS, which we use in syphilis. ठीक है, स्टेन्स हो गए. अब करते हैं ग्रोथ. Then growth media. So first is selective media. Selective media is which favors the growth of a particular organism. ठीक है, for example, Thayer-Martin media for Neisseria. Then indicator media is also called as differential media. It yields a color change in response to the metabolism of certain organism, and this is a very good and like important example of a differential media is McConkey agar, right? It has a pH indicator, and a lactose fermenter, which is E. coli, will convert lactose to acidic metabolites and the color will change to pink. Okay, now this is a table which shows the specific requirements of specific cultural requirement. ठीक है, H influenza on chocolate agar, it requires two factors 5 NAD and factor 10 which is hemin. Remember, इसको याद करने का एक formula है, not a formula but a thing is that H influenza requires both. ठीक है, while para influenza it requires only factor 5. ठीक है, जहाँ भी होगा para influenza like para hemolyticus, para influenza, these all will require only factor 5, while others will require both factor 5 and factor 10. ठीक है, and one more example is Haemophilus ducreyi. This requires only factor 10. ठीक है, this is important because this has buboes, है ना, so we'll learn about this in a while. Then Neisseria in Thayer-Martin media, it selectively favors growth of Neisseria. We read it is a selective media. ठीक है, because it inhibits the growth of gram-positive organism due to the presence of vancomycin, and gram-negative organism except Neisseria due to the presence of trimethoprim and cholecystine. ठीक है, और तीसरी चीज़ क्या है? It has nystatin which prevents the growth of fungi. तो Thayer-Martin में what are the antibodies? This question has also been asked. So first is vancomycin. This will inhibit gram-positive bacteria. Then trimethoprim, this will prevent gram-negative except Neisseria, also cholecystine. And third is nystatin for fungus. ठीक है, तो इसलिए this is a selective media. Then Bordetella pertussis. ठीक है, तो मीडिया में के नाम में ही Bordet है, so this is obvious that it will be for Bordetella pertussis only. And Regan-Lowy media, it has charcoal, blood, antibodies and potato extract. ठीक है, then Corynebacterium diphtheriae is tellurite agar or Loeffler-medium. So you remember that it is also called as Loeffler's bacilli. ठीक है, तो Loeffler की सारी चीज़ें इसी में आएंगी. So Loeffler's medium is used for Corynebacterium diphtheriae. Then tuberculosis, Lowenstein-Jensen medium. This everyone knows. LJ media. Okay. Other media, Middlebrook media. This is a liquid media. And then there can be rapid automated cultures like BACTEC, right? Colorimetric or fluorimetric. देन माइकोप्लाज्मा निमोनिया, ठीक है, इसका भी नाम होता है ईटन एजेंट. तो इट इज़ ईजी टू रिमेंबर द culture media, which is the eaten agar, and remember that it has cholesterol, so which is a requirement of mycoplasma pneumoniae. ठीक है. Then talking about lactose fermenting enterics, lactose fermenters like E. coli. ठीक है. So lactose fermenters will grow in McConkey agar, and remember we already read that the fermentation produces acid causing the colonies to turn pink. So if on McConkey we see pink colonies, then it means those are lactose fermenters, and this McConkey is now a differential or an indicator media. Then next are Brucella, Francisella, Legionella, Pasteurella. These all are grown on charcoal yeast extract agar buffered with cysteine and iron. ठीक है. तो BCYE agar. एंड हाँ, ई कोलाई का रह गया था. इट इज़ EMBA agar. EMBA is eosin methylene blue agar, and the colonies will have a green sheen, green metallic sheen to it. ठीक है. तो ऐसी ऐसी colonies होंगी metallic green, that is on EMB agar. This is E. coli, and PCYE agar is for Brucella, Francisella, Legionella, Pasteurella. The mnemonic is, remember, Ella से end होने वाले. ठीक है. Ella, 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 Ella. So these are all siblings. Who are the siblings? Bruce, Francis, right? And there is a pastor who built the Sistine Chapel out of charcoal and iron. ठीक है. तो क्या है? This is the Sistine Chapel, which is made up of charcoal and iron. ठीक है. तो इसको बनाने के लिए एक pastor होगा. This pastor, he built this thing, and who comes here? The Ella siblings, Bruce and Francis. This is pastor. ठीक है. तो क्या हो गया? Brucella, Francisella, Pasteurella and Legionella. ठीक है. इनके लिए मीडियम कौन सा हो गया? चारकोल, आयरन, एंड दिस इज सिस्टीन चैपल. ठीक है. तो इसको बफर कर दो. बफर्ड चारकोल yeast agar, which has cysteine and iron. Yeah. ठीक है. Easy. Then next fungi. For that it is Sabrods agar. Remember sabs a fungi है ना, तो उसके लिए Sabrods agar. ये तो ऐसे ही सबको याद रहता है. तो क्या क्या हो गए? H influenza is easy, chocolate agar. It requires factor 5 and 10. ठीक है. Gonorrhea, Thayer-Martin, it will have antibodies for inhibiting other organism. Bordetella pertussis, it has some things, and the media is the name. Again, diphtheria, Loeffler's bacilli, the medium is the name. This is the Loeffler's medium. Same with mycoplasma, the medium is the name, which is the eaten agent. Then TB का सबको याद रहता है LJ medium. ऐसी fungus का सबको याद रहता है Sabrods agar. So TB is LJ medium and fungus is Sabrods agar. Then lactose fermenting enterics के लिए McConkey pink हो जाता है if it is a lactose fermenting. E. coli के लिए EMB agar, which will show green colonies, and the Ella siblings Bruce and Francis goes to the Sistine Chapel, which is made by the pastor. ठीक है. out of iron and cysteine. So इनके लिए हो गया BCYE agar, buffered charcoal yeast extract agar, which contains iron and cysteine. So these are all the important culture medium done and dusted. Okay, now let us talk about aerobes. We know that aerobes require oxygen, and aerobes के examples are Nocardia, Pseudomonas, Mycobacterium, Bordetella. ठीक है. तो इसीलिए there is a fact that if TB bacteria regenerates, it has a preference for the apices of lung, which have greater oxygen. Then anaerobes के examples, anaerobes cannot breathe in fresh air, है ना. तो इसके examples ऐसे हो गए. CBFA, cannot breathe in fresh air. Then C से Clostridia, B से bacteroids. This question was asked अभी. Then F से Fusobacterium and A से Actinomyces israeli. Next are some intracellular bacilli. like Rickettsia, Chlamydia, Coxiella. ठीक है. And facultative intracellular are Salmonella, Neisseria, Brucella, Mycobacterium, Francisella, Legionella, Yersinia. कैसे याद रखना है? एक तो रिमेंबर रियली चिली एंड कोल्ड, है ना. तो जिनको बहुत ज़्यादा ठंड लगती है वो हमेशा घर के अंदर रहते हैं. हु आर दीज रियली चिली एंड कोल्ड? रिकेट्सिया, क्लेमाइडिया एंड कॉक्सियला. देन some nasty bugs may live facultatively, so these are facultative intracellular, and this is Salmonella, Neisseria, Brucella, Mycobacterium, Listeria, Francisella and Yersinia pestis. ठीक है. Then encapsulated bacteria. So the examples are Pseudomonas, Streptococcus, Haemophilus, Neisseria, E. coli, Salmonella, Klebsiella. ठीक है. Their capsules, they have antiphagocytic virulence factor, and remember that capsule polysaccharide plus protein conjugate, it serves as antigen in vaccines as well, है ना. तो the mnemonic is please shine my skies. ठीक है. तो P से Pseudomonas, then Streptococcus, Haemophilus influenzae, N से Neisseria, E से E. coli, then S से Salmonella, K से Klebsiella and S से group B Streptococcus. ठीक है. Remember that they are opsonized and then cleaved by the spleen. So in A splenics, remember no spleen here. Neisseria, Streptococcus pneumoniae, H influenza, there is increased risk of infection. Hence in तीनों की we give vaccine to the patient. ठीक है. What? No spleen here in A splenics. Right? The vaccination is required for Neisseria meningitis, Streptococcus pneumoniae and Haemophilus influenza. Then encapsulated bacteria vaccine, right? It is for H influenza type V vaccine and meningococcus conjugate vaccine. ठीक है. These two are the vaccines. Then urease positive organism, इसका mnemonic है pub, chunks. ठीक है. P is for Proteus, B is for Burkholderia pseudomylae, C is for Cryptococcus. I'm sorry for my bad writing, I'm just going very fast. H is for H. pylori, U is for Ureaplasma, N is Nocardia, K is Klebsiella, and S is cons, that is Staph epidermidis and Staph saprophyticus. ठीक है. So what happens is that the urease hydrolyzes urea to release ammonia and carbon dioxide. ठीक है. तो इसकी वजह से the pH increases and this predisposes to the formation of true white stones, most commonly seen with Proteus. ठीक है. So this is a surgery question done here. That's true white stones. Most common organism is Proteus. Then next, catalase positive organism. ठीक है. So what they do, the catalase, it degrades H2O2 into O2. ठीक है. तो फिर we can see bubbles of CO2, and people with chronic granulomatous disease, that is they have NADPH deficiency, they may have infections with catalase positive organisms. This is an integration with patho. ठीक है. So what are the catalase positive organisms? Staph we already know. Then apart from that, Nocardia, Pseudomonas, है ना. Candida, Listeria, E. coli and Aspergillus, Helicobacter, Bordetella pertussis. These are all catalase positive. What you need to remember is Pseudomonas and Staph. तो हैं ही very important. Then pigment producing bacteria. First is Actomyces israeli. It has yellow sulfur granules. सबको पता है. S. aureus golden yellow pigment, है ना. तो we say oiled paint colony. Then Pseudomonas aeruginosa, it has pyocyanin and pyoverdin, which are blue-green pigment, and Serratia macerans, it has red pigment. ठीक है. Serratia, Sriracha, तो Sriracha is red. Then the organisms that produce biofilms. First is epidermidis, Staph epidermidis. This is cons, and Coagulous negative Staph, and it infects catheter and prosthetic device. Then viridins, Streptococci, like S. mutans, S. sanguinis. It causes dental plaques and infective endocarditis. Then Pseudomonas aeruginosa, right, respiratory tree colonization, especially in patients with cystic fibrosis, and ventilator associated pneumonia, and also contact lens associated keratitis. This is also being tested upon n number of times. Pseudomonas, wherever it comes, is very important. Like Staph is the king of bacteria, Pseudomonas is the king of gram negative bacteria, you can say. Then non-typable, or unencapsulated H influenza, it leads to otitis media. ठीक है. Next are spore forming bacteria, right? Spores are very resistant and they are only killed by autoclaving at 121 degrees for 15 minutes. The examples are Bacillus anthracis. This is very important. Okay, remember Bacillus forms non-bulging spores and only in soil. Okay, other is Clostridium. Clostridium, it forms bulging spores and in soil as well as human body. ठीक है. तो बैसिलस का क्या हो गए? बैसिलस एंथ्रासिस, बैसिलस सीरियस, एंथ्रासिस causes anthrax and bacillus cereus causes food poisoning. Clostridium is further of 4 types: botulinum, which causes botulism or floppy infant syndrome in babies; Clostridium difficile, that leads to pseudomembranous colitis; then Clostridium perfringens, which causes gas gangrene; and Clostridium tetani, that causes tetanus. Then some bacterial virulence factor. First is protein. These are important virulence factor. Protein A, right? It binds to the Fc region of IgG and it is seen in staph. Second is IgA protease. ठीक है. This is the enzyme that cleaves the IgA and it is seen in Shin. Shin bacteria कौन से थे? Remember, Streptococcus pneumoniae, H influenza type B and Neisseria. ठीक है. Then M protein. It helps to prevent phagocytosis by and it is seen in group A streptococci. ठीक है. It has homology with human tropomyosin and myosin, that is molecular mimicry, and it is also seen in the autoimmune response of acute rheumatic fever. Bacterial exotoxins. ठीक है. So first is Corynebacterium diphtheriae. The toxin is diphtheria toxin and it inactivates the elongation factor 2. Remember, exotoxin A of Pseudomonas also inactivates the elongation factor 2. So, what is the manifestation? It causes pharyngitis with pseudomembranes and bullneck, and Pseudomonas, it causes the death of host cell. Okay, next is Shigella toxin, that is a sugar toxin, and the EHEC E. coli. These two inactivates the 60S ribosome by removing adenine from the rRNA. That leads to damage of the GI mucosa and dysentery, and it also enhances cytokine release, leading to hemolytic uremic syndrome, especially with EHEC O157H7. Right? Remember, EHEC does not invade the host cell, but Shigella invades the host cell. So first is inhibition of protein synthesis, that is with Corynebacterium and Pseudomonas. Elongation factor 2 ka problem. Shigella and EHEC, they are both same, causing HUS by inactivating the 60S ribosome. Second is increasing fluid secretion. So this is seen with ETEC, enterotoxicogenic E. coli, that has two toxin, heat labile LT, heat stable ST. ठीक है. Remember, LT increases the CAMP while ST is responsible for increasing CGMP. So CAMP के बढ़ने से what is there? Increased chloride secretion and इसकी वजह से decreased salt resorption. So these two, they lead to watery diarrhea. ठीक है. This is important. Remember, labile in the air. इसको छोड़ दो. Then next, Bacillus anthracis, anthrax toxin. It mimics adenine cyclates and increases CAMP, ठीक है, and likely responsible for characteristic edematous borders of the black scar in the cutaneous anthrax. Next is Vibrio cholerae, cholera toxin. It also overactivates CAMP by permanently activating the GS subunit and leads to voluminous watery diarrhea. So fluid secretion बढ़ाने वाले कौन कौन से हैं? ETEC, Bacillus anthracis and Vibrio cholera. Next mechanism is by inhibiting phagocytic ability. So इसमें the example is Bordetella pertussis, the pertussin toxin. It also increases CAMP and it leads to whooping cough. तो CAMP को बढ़ाने वाले जो हैं उसका mnemonic is CEAP. ठीक है. C से है cholera, ETEC, anthrax and pertussis. ये सब हो गए कैंप. ठीक है. देन दी above three, first three, they causes increase in fluid secretion, while this causes decreased phagocytic ability, right? Fourth mechanism is by inhibiting release of neurotransmitter. Okay, this can be seen with Clostridium tetani, that is the tetanospasmin, and the Clostridium botulinum, which is the botulinum toxin. Both are proteases that cleave the snare protein, right? And they decrease the release of GABA from the presynaptic Renshaw cell. Okay, that causes tetanus in that causes tetanus. And in infant botulism, which is caused by ingestion of soil and raw honey, okay, toxin is produced in vivo due to the consumption of these organisms. Then in foodborne botulism, there is ingestion of preformed toxins in canned food. This leads to diarrhea. Then next mechanism is by lysis of cell membrane. Okay, this is by Clostridium perfringens and Streptococcus pyogenes. तो इसका alpha toxin and इसका streptolysin O. So in Clostridium perfringens, the alpha toxin, which is the phospholipase or lysinase, it degrades the tissue and the cell membranes, which causes myonecrosis and hence gas gangrene and hemolysis, right? And remember, there is double zone of hemolysis seen on blood agar. While with Streptococcus pyogenes, the ASO, it is a protein that degrades the cell membrane and it leads to beta hemolysis, right? Remember that the host antibodies against ASO, that is anti-ASO, is used to diagnose the rheumatic fever. The next mechanism is super antigens. Okay, so super antigen is seen with Staph aureus, which is the TSST1, and second is again pyogenes, that is the erythrogenic exotoxin A. Now what they do is they cross-link to the beta region of T cell receptor to MCH2 on the APC, that causes an increased release of interleukins like IL-1, IL-2, interferon gamma, TNF alpha, and finally leads to shock. Okay, so TSST1, it leads to toxic shock syndrome, while Streptococcus pyogenes, it leads to toxic shock like syndrome and scarlet fever. Then the endotoxins. Okay, endotoxins, they are exclusively found in the outer membrane of gram-negative bacteria. They are composed of, this is an important question. They are composed of O antigen, core polysaccharide, and lipid A. And remember, lipid A is the toxic component. The lipid A component of endotoxin, it leads to macrophage activation, complement activation, and tissue factor activation. Macrophage activation, it causes release of IL-1, that leads to fever, TNF alpha leads to fever and hypotension, and nitric oxide, that leads to hypotension. So there is decreased BP. Then complement activation, C3A and C5A formed. C3A causes histamine release, again it leads to hypotension and edema. C5A causes neutrophil chemotaxis. Then tissue factor activation leads to a coagulation cascade and leads to DIC. So this leads to shock. Okay, तो याद करने के लिए we just use the abbreviation endotoxins, right? It causes edema, then it leads to release of nitric oxide leading to decrease in BP, then DIC, outer membranes release होते हैं, then they release TNF alpha, O antigen plus core polysaccharide plus lipid A, and they are extremely heat stable. IL-1, IL-6 are released, neutrophil chemotaxis by C5A, and finally shock. So this completes general bacteriology. Stay tuned for part 2, which is the clinical bacteriology.